This episode is brought to you by our sponsor, Artery Inc., a local women-owned company that designs anatomy-inspired apparel and other merchandise. They started at local farmers markets, and now they ship worldwide from right here in Milwaukee. They are a good company with very charitable ties to our community, so we encourage you to go check out their stuff by going to www.arteryinc.com, that's INK, and using the promo code PHPOD to save 10% on orders over $35. And note this does exclude the bonus boxes, however. Let's get to the show. This podcast is for informational purposes only. It is not intended to provide medical advice. It exists only to entertain. At Grace Hospital in Detroit, Michigan in 1926, an enthusiastic and overachieving resident must present the case of his patient, a 52-year-old magician and entertainer who was admitted to the hospital with abdominal pain, to his attending surgeon and fellow residents.
All right, let's move on to the next patient. Here we are at room 401. Which resident has this patient to present?
That's your patient, man. You got this.
That's my patient, sir.
Are you ready to present?
I think so.
Okay, on with it then.
All right, so here we have Mr. H.H., who is a 52-year-old male who presented last night with a chief complaint of abdominal pain. He states that it started...
No, wait.
What?
Is that the best you can do?
I mean, I barely started.
Well, my attention span is already waning. I mean, let's get to the point. Be concise.
Okay. This is H.H. He has abdominal pain. I think it's appendicitis, so I'm recommending an operation.
No. Look, way too clinical and cold. You need to add more panache. Patient presentation is an art form. You need to be concise and engaging. I need to hear details of your exam, diagnosis, and proposed plan, but I don't want to be bored to death by them.
More engaging. Okay. My patient, H.H., is a world-famous performer in the magical arts who cast himself upon the mercy of this hospital with a chief grievance of abdominal pain of an unrelenting nature for the past 2 days and nights.
Caesar, what are you doing?
You said more engaging, so I thought I'd spice up the delivery a little bit.
It's the best you have to get. I'm here for a patient presentation. So again, concise, engaging, and put some damn feeling into it.
Okay, concise, engaging, and with feeling. Ladies and gentlemen, residents and surgeons, step right up to hear the astounding case of H.H., my 52-year-old patient who, despite a career of death-defying escapes and untold numerous battles with spiritual swindlers, casts himself upon the stage with a chief complaint of abdominal pain. Be astounded by his physical exam, suggestive of lancinating, searing pain in his lower abdomen, which has reached such a crescendo of unpleasantness that I, as a resident surgeon, feel confidently that there is no other alternative than a harrowing procedure to open his abdomen and cast out the pus-laden evil, which undoubtedly awaits a life-and-death battle with the cold surgical steel of our scalpel. Let us proceed to the operating room to cast this man's appendix out of his body. It's showtime!
Maybe dial it back a bit.
God, I hate rounding.
I actually like rounding.
Shut up, nobody likes you.
Oh.
That's classic.
Throughout history, this is Max and Mary, Mike and me. You gotta listen, you don't have to read. For historians, for historians.
Welcome, everyone. This is For Historians, a podcast delving into the archives of medical history. As three emergency physicians, we will explore the unusual ailments, treatments, and physicians, and all related material having to do with the healing arts. I'm Max, and I'm joined here by my good friends and colleagues, Aaron and Mike. Gentlemen, do you know your way around a pair of handcuffs?
Only if they have fuzzy covers on them. Then I know.
Well, Aaron knows his way around handcuffs.
That was
Mike, how about you?
He can't get over it.
Mike only knows about the handcuffs from being in the back of squad cars. So, any shout outs or news from you gentlemen at all? All right, great segment. But I did want to tease one thing. So I was going through and realizing we've kind of been getting a lot more messages lately. A lot of folks reaching out to the show and sending us really good suggestions of possible show topics and things like that. And some of them are very easily translatable to a full show. Some of them are really interesting, but may not necessarily have full show potential. That being said, we also want to acknowledge the folks taking the time to send these in and try to respond to them in some sort of way. So we are thinking we would like you to definitely send us questions, but we want to have you send us any medical history questions you would like us to answer in a short form format. And we're going to go ahead and pass them over to Mike in his mailbag, and he will...
I call it scrotal sack, but you can call it mailbag if you'd like.
We're going to call it mailbag. And Mike's going to go ahead and give you an answer without doing his usual rigorous research and citation. So he's just going to use the power of his own knowledge and his mind and his memories to give you the most accurate answer he can come up with on the spot. So for next show that we do, I encourage you to send us in a question. It's something short you want us to know. You want to know about medical history from Mike himself.
Just the medical history that I currently have in my brain.
Yeah, no, he can't cheat. He has to come up with an answer for you. So we would invite you to send those out, and we will pick one, and we shall use it. So
I'm pretty sure I know almost everything about everything, so it's not that big of a deal. It'll be easy. I look forward to the minimal challenge that this may be.
So that sounds like he needs a real challenge.
Yeah, what's that window? The Dunning-Kruger window? I forget.
Oh, the Dunning-Kruger effect. Yes, definitely.
Oh, is that? Yes, that's
here.
that effect that Dunning and Kruger had come up with back years ago when they wrote that book about it.
Exactly.
That's exactly what it is.
That. It's the confidence he has that explains the effect too.
Yep, definitely.
So we'll see where that goes.
Such an interesting
I will invite
effect.
you to keep sending us stuff because it's really, really fun to read. And if you have sent us something you've noticed, we respond. So there you go. On that, any other business to discuss, or shall we just get to it?
I think we just get to it.
Fine. On the heels of our last case discussion, referring to the prior Princess Diana episode, we got a lot of good feedback about that. A lot of folks wrote in. They really enjoyed kind of the way we went about that case. And so we kind of wanted to take another famous medical case and kind of apply a similar principle to it. So with that, let's talk about another case, one that involves kind of one of my own personal heroes, Eric Weiss.
It's here it says Erich.
Yeah, Erich Weiss's. Who the is Erich Weiss's?
Eric Weiss, you may know him, gentlemen, as the famous Harry Houdini. You heard of him? Okay, just checking. So, but do you guys know how Houdini died?
Being from Appleton, I think is how he died. Isn't that what it is?
Oh, is he
close?
From Wisconsin?
He is a Wisconsin.
Yeah.
Well,
he was attacked by a polar bear, I think.
Yeah, exactly. So there's a lot of popular misconception, which you're both dodging aptly, which is that he died doing one of his famous escape tricks, which is not the case.
Well, so actually the story I do remember is that he used to have such rock hard abs that he would invite passersby to punch him in the stomach. And so I heard that he was punched in the stomach so hard by a passerby that he died later that day of ruptured something. So that
you're onto something there. It's going to go in an interesting couple of twists and turns, but that's part of the story, and we're going to go into it, right?
Yes, I got part of it right.
Part of partial credit. Mike gets no credit.
Wait, no, because we talked about before the show that he got punched in the wiener. And
we sure did.
And somebody said you can't
that.
die by getting punched in the wiener, and that is something that we're going to have to prove. Mythbusters is going to have to cover this. See if we can kill
let's not
somebody
cover
by
that.
punching them in the wiener.
No,
I believe
let's
Aaron
not.
said you can't die by that, and I said it depends who does it. And then you
Yeah.
started talking about Chuck Norris, and it went from there. So,
Roll the tape.
many people know Houdini as a magician and escape artist, and he was very much those things. But Houdini was also a world-renowned debunker, and with his vast knowledge of designing and performing illusions and human psychology and those sort of things, he was especially adept at confronting and exposing psychics and spiritualists who were really popular at this time with a rise in something called spiritualism. And they would take money in exchange for pretending to contact one's deceased family members. And Houdini, for reasons we won't go on just because this isn't, we're not diving into the entirety of his biography, but he took a particular exception to that and was on kind of a personal crusade against a lot of these folks. So on one hand, he was a big time performer. On the other hand, he was just a very ardent skeptic. And so, like I said, a full retelling of his life is a little bit beyond this medical history show, but we should do at least a little bit of a brief summary to set the scene here. So he was born Erich Weiss in Budapest, Hungary in 1874.
Erich.
Budapest.
Yeah, it's Budapest.
It is definitely not those things, but he was born there in 1874.
You don't get the reference because you didn't watch all the Marvel movies.
That is true. I will have to live with that and not get the reference. What is the reference?
It's just they referenced Budapest in a couple of shows.
Whenever somebody says it wrong, Black Widow corrects them.
And she says Budapest. She's the one that says Budapest.
It is Budapest?
I don't know, but I've never actually been there.
Listenership.
Well, I'm not going to watch
I believe
movie,
whatever
so.
Black Widow says. That's my general life rule.
Fair enough.
Wait, is Hungary right next to satiated? Is that a country too? Or is...
So Houdini's father was a rabbi, and the family moved to the U.S. on July 3rd, 1878, and landed in, of all places, as Mike gave away, Appleton, Wisconsin, right? Kind of a local boy.
I thought it was Crappleton.
We have to have listeners. I'm sure we do there. So you can write to Mike with all of your complaints. I think the Appleton's just fine.
Nowhere near as nice as Nina.
My favorite part of Appleton is the Fazoli's off the freeway.
I haven't been to a Fazoli's in so long.
I keep talking about it. I really want to go to one.
How authentic is it? Let's do a road trip.
Yeah.
We'll go up to the Appleton Fazoli's. That being said, he later moved with his family to good old Milwaukee. And there was a big rabbit hole where I went to, like, all the places he used to go. I started reading about it, and suffice it to say, I actually sent an email off to our friends over at the Wisconsin Drunken History podcast and said, "Hey, you should check this out." And they said, "Thank you, we actually will." That being said, as a child, a young Erich Weiss saw a magician named the Bloodless Vivisectionist at the Dime Museum here in Milwaukee. And it was like described as this kind of lurid theater at one of these articles, end quote, down on Wisconsin Avenue. And this place sounds amazing. It's way not there anymore, but it was just sort of this strange oddities museum and whatnot. But it had this magician, and the magician used a bunch of knives to basically appear to dismember a volunteer in the audience in front of the live crowd. And then at the end, there was some sort of flourish where he then reassembled the person, and all the apparently amputated appendages were all reattached. And a young then Erich Weiss, later Houdini, saw this and was absolutely hooked. He was just said, "This magic is my future career." And I can only wish my career story was that interesting, but
it kind of
sure,
is.
when he went to his parents and he's like, "I'm going to be a magician," and they're like, "No."
Well, back then it was only you were either going to be a doctor, a magician, a pharmacist, or a construction worker, or just
those
father.
are the four professions. Those are the pillars. Those pillars of America, as they say.
He could have gone the other way and said, "I'm going to be a vivisectionist." So I guess, that's win-one.
It's that is very true. I don't have any funny statement for that.
Yes.
So Eric is pursuing his dream of professional magicianship, which I suppose is a word, and he starts calling himself Harry Houdini after reading the biography of Jean-Eugène Robert Houdin in 1890. And I'm going to gloss over a lot of his life, but it's good to just appreciate that Houdini was far from successful when he started. He was kind of given this review of being, he's okay at sleight of hand stuff, and he could do some close-up magic. He wasn't exceptionally gifted, but he could, however, escape from a pair of handcuffs. And so in 1899, when he impressed a manager named Martin Beck while he was in St. Paul, Minnesota, by getting out of handcuffs, he sort of then his career starts to really skyrocket, and he then was advised by this manager, why don't you do the escape stuff? That stuff's, I mean, it's like 1899. There's not a lot going on. You can't watch TV. I don't know if radio's a thing. So if you can like get out of these handcuffs, people are going to lose their mind, which was true for the time. And so by degrees, he basically went from this from Appleton, Wisconsin to like international magic superstar.
Because he could get out of handcuffs.
Well, that's...
How many people were on the planet at this time? Would it be a billion?
No, it was probably like 3,000 or 4,000.
So then okay.
Yeah, the bar used to be a bit lower.
Yeah. Well, okay. So if getting out of handcuffs isn't enough for you,
Bill down the street
gentlemen,
could walk across the street without jaywalking and without tripping. He was a sensation.
It's all about marketing, man. But that being said, so this escalated beyond just handcuffs. His escapes, basically, they became more and more ornate. So like some of them were crazy, incredible, and actually legitimately dangerous. Like one of his, a couple of his notable ones, like was the water torture cell, where he would basically be suspended upside down. His feet were locked in manacles, and he would be lowered into this water chamber, head down. Usually it was like kind of a glass or whatnot, so people could watch. And he had to basically free himself from the manacles holding his feet and get out of the water chamber, which he did successfully. He also had one of his other famous ones was where he would be sealed into a container, like a packing crate. He would be nailed into it in manacles that were leg irons and that sort of thing. And then 200 pounds of lead were added, and they threw him into the East River in New York City. And it took him 57 seconds, but he got out and left the crate completely intact with the manacles inside and swam to the surface. And hey, again, this is, turn of the century. This is pretty impressive stuff. I mean, I'd go see it. I don't know about you guys.
But it'd be impressive
I don't know if I
now.
would.
I mean, even now, and then like one of his most famous was the buried alive stunts, where he would basically be buried alive. They would throw him in like kind of a coffin or chamber. In fact, in Santa Ana, California, in 1915, his first attempt at this trick, he almost died. He was thrown on the ground. They covered him with a bunch of dirt, and he had to like basically get himself out and whatnot. But he kind of underestimated the weight of the dirt and started panicking basically as he dug himself to the surface. He managed to get like one hand out, and his assistants had to pull him out of the ground before he suffocated. He did the trick a couple of more times, refining it, but I should actually be clear that people have tried to replicate these tricks, and there have been magicians who have died doing especially that trick. So there is something to it, but it is definitely dangerous. We're not advocating that anybody try these things, because Houdini was the man for a reason.
Well, he was probably really smart, right? He probably knew physics. He knew these things. He knew what, like the people that are trying to reproduce these stunts probably were just like, oh, let's just dump dirt on a crate. I'll be able to dig my way out.
Sure. No, and tons of thought go into these illusions. And so, and he usually would copyright a lot of the ways he would do it and, or trademark it and try to protect the property there. So like some of his famous devices are like they've been lost to time, but some of them are preserved, and they're extremely inventive, and he's just a really cool person. We're going to talk about like the end of his life, but there's a lot more to learn there. I just want to throw that out.
So it's more than the 1800s jackass. That's
oh yeah, no, this was classic.
Just imagine if he had like an Instagram account now. Oh, it'd be terrible. We would hate him.
Yeah. Fortunately, this was before all that. So you just had newspaper reports, which are more or less favorable. Anyway, the other fascinating part of his career was basically he was a big-time debunker of mystics, and he went out of his way to basically bring some of the illusions that some of these people were using to light, because he knew that trick of the trade. And so he could make people believe in the impossibility of his own spectacles. But, on the other hand, when he found people who were making claims that couldn't be substantiated or using interesting parlor tricks to try to make like a seance seem real, he would expose them. And so he became internationally known for that as well, and made plenty of enemies, certainly in that world. And that's kind of like the other part of his story. So it's just a lot more to this guy that we're just going to have to gloss over, because we're going to go to the medical history part of it. And so go do your own deep dive on Houdini. With all that being said, let's go to that medical case. So among all the death-defying escape acts and all the professional psychic busting, Houdini had a bit where he would challenge people to punch him in the stomach, like you said, Aaron. So he,
Knew it.
I don't know if you've seen pictures of Houdini, but like he was kind of like, medically speaking, especially for the time, jacked and like had lots of muscles that you didn't always see on people at that time. So he would challenge people, like, punch me in the stomach. Obviously he would brace himself and, he'd use I think, Aaron, did you say rippling rock hard abs? How did you put that?
I don't remember. Did I talk about his abs specifically?
I think you did. You said rippling.
I don't know that he was jacked. Is this,
Get an
you're
eight-pack?
saying for the time?
I was saying for the time.
Well,
I mean,
CrossFit was just kind of coming into vogue around 1915.
Yeah, but did he even live?
I suspect that he did. So yeah, he would have people punch him. He would be prepared for the punch, and it's okay. Punch somebody with a good strong set of abs. I guess again, turn of the century, impressive. Ooh,
Sure.
punched him. It didn't hurt him.
Yeah, they used to do
didn't
like
take
the
much.
breaking the cinder blocks over the abs and.
One of my, have you ever, I don't know if it still happens, but like late night ESPN, like 6, when they just have the weirdest stuff on. I once watched a whole like karate championship that was like people breaking boards as fast as possible and like punching cinder blocks, but like everybody had a mullet, and it was like
Awesome.
from Florida doing karate with, I think it was actually, it was sponsored by Paul Mitchell and like Vidal Sassoon or whatever.
No, it wasn't.
It was so, it 100% was.
They're all
and-
from
Florida
their
karate, you have
dojos.
to use your forehead for all the breaking.
Now it's fair. I don't know all the rules, but I'm just saying this is a thing that plenty of people do. So speaking of stomach punches, in Montreal, Canada, on October 22nd, 1926, Houdini is backstage prior to his performance that night. He's laying down on a couch, kicking back. He's in the company of 3 local medical students from McGill University, which we've definitely mentioned a few times on the show. And he's lying on that couch because he broke his ankle in a previous performance, and so he's kicking back and chilling. So he's talking with these students, and the topic of his ability to withstand punches to the abdomen comes up. And one of the medical students, named Gordon Whitehead, asks if it's true that Houdini's claim that he can't be hurt by gut punches. And Houdini says it's true. And I'm not clear about this part from what I've read, but he either invites Whitehead to try, or Whitehead's like, okay, I'm going to try, and basically just starts wailing on Houdini's lower abdomen, like just without any preparation. So Houdini couldn't tighten his abs. He's laying back on the couch because he can't like stand on his ankle, so he can't brace that way. And apparently this dude just starts raining down blows on his abdomen.
It says here below the belt, so he did get punched in the.
Well, it does
In the
say
wiener.
that, but I'm going to propose to you that when they say below the belt, you're like grandparents, like the belt was up to the nipple line.
It was above the
so
navel,
I
yeah.
actually think they wore belts higher back then, is what it was.
We should go back to that, everybody. That's all.
Mhm.
think so?
Make a movement.
Bring back high belts.
Is it because we're all getting older and it makes more sense to have a belt that high?
Yeah.
I mean, is this because
you can either go above or below.
you got to make a choice at some point as you get older where the belt goes?
It would
And I think
decrease the risk of
suspenders.
neuralgia paresthetica if you wear a higher belt.
True.
And
It's true.
that's okay. Yeah.
That's a deep
So-
dive right there. See, maybe Mike does know everything.
Mm-hmm.
Well, obviously he does. He's going to do the mailbag segment.
Obviously do.
So suffice it to say, he got punched really hard with
In the
no
wiener.
preparation, lower abdomen, and like he was even described as like telling, like, please stop, dude. Like, I'm not
What are
ready.
you
Quit punching me in
doing?
the damn stomach.
What, doesn't he have arms? Couldn't he have like like put him in the
Punch
way?
the guy back.
Like in my head, the guy's like goes immediate, like there's no hesitation. He's like, so is it true? And he's like, yeah, bam, like
But I mean, if you get hit once really hard like that, your arms are gonna naturally kind of protect yourself. You might draw your knees up.
yeah.
But his
I don't
ankle's
know.
broken.
Well, it doesn't mean your
can't-
knee's broken.
Maybe there's a new
Then you're-
segment. We punch Mike in the stomach and test this. We're just gonna.
How many blows you can get in before he braces it? Oh, I guarantee you,
Oh.
it's probably 1, maybe 2, but not 3.
Yeah,
Well,
well, it was
anyway.
it was apparently enough. So as he goes to the performance, he appears to be in pain already, and he spends the next 2 days in what is described as 24/7 pain. But his next show is in Detroit. And so he travels from Montreal to Detroit on October 24th, 1926. And by the time he arrives in Detroit, he decides before he goes to the show that I'm going to go see a doctor. And so he shows up to a doctor. He has a fever of 102 degrees at the time. The doctor's like, I think we should do surgery on your stomach. Something's wrong. And Houdini's like, yeah, cool. I got a show. I'm going to go to the show, and then we'll see how this all like works out afterwards.
So he signed out
People
AMA
been-
and went to the
yeah,
show.
He
people
basically
been
did.
leaving
He signed out against the medical
for
advice of
hundreds of
the
years.
doctor who was like, you should have a surgery. And then he went to the Garrick Theater in Detroit to carry on his performance. And apparently by the time he takes the stage, his fever is like 104 degrees. The audience knows something's off. He's making mistakes that he really never makes. He just looks ill-appearing. There's actually one account that he passed out midway through the performance, had to be
Oh, no.
revived, and like still continued and finished the show to the best of his ability.
Backed into a
And
new
then-
trick.
Yeah, pretty much. And he says, finally, by the time that all ends, he returns to the hospital, Detroit's Grace Hospital, and he goes to seek medical attention. And so at that point, he's admitted right to the hospital with abdominal pain and fever. And I'm not sure why this next part transpires, but it takes a few days go by until he has an operation.
He's too sick for surgery.
Yeah. And so, well, actually, let's pause here for the moment. Yeah, he's too really, but let's pause here for the moment. And I mean, we've done the skit, we've done this stuff. So, I mean, what does this sound like to two modern emergency physicians? You're working at Grace Hospital in Detroit in 1926. They bring in a guy with abdominal pain and fever.
We 26 or no?
This is
As
you
I was
are
gonna
now.
say, it sounds
You
like
exist
a CT
now, but
scan.
yeah. So it's I should
So I get-
say you're right, Mike. So yeah, nowadays you're gonna probably put that person into a CAT scanner to take a look and see what's going on, and that's going to give you a better idea. And we're suspecting what? We're suspecting.
I mean,
Well,
could
it's
be
got fever now.
Yeah.
So some sort of ruptured something inside the belly. That's how I would.
with
yeah.
pain, but pyelonephritis, the kidney infection, kidney stone.
Kidney infection. Infected kidney stone. I mean,
colon
could be referred
infection.
pain from diverticulitis, an infection of the large
It
intestine.
could be perforated diverticulitis or just regular or
Yeah.
run-of-the-mill
Could be.
diverticulitis.
Well,
It could be.
the punch is going to be a red flag, right? So people come in and they're like, "Oh, this guy punched me in the stomach, and now I have a lot
so
of
you
pain."
think
So you're like, "Well,
splenic
what?"
injury.
Yeah, like punch and
Liver
fever
injury.
is weird.
Yeah, you're like, "Well, that doesn't make a lot of sense." I'll be like, "Well,
Yeah,
I
I mean-
fell, and now I have a fever of 105." And you're like, "Nah, I don't know how those." Yeah, that would be
Yeah.
the weird part.
And like punches too. I mean, this is all described as lower abdomen. Like if you get punched in the right upper abdomen or left upper abdomen, you got two big solid organs. The right side, you've got your liver, which if it gets hit hard enough can bruise or lacerate, basically tear and bleed. Same with the spleen. I mean, the spleen is tucked up under the ribs too on the left side. And those are the organs, like when you get hit, you kind of think about, oh man, are those two things bleeding? And if you get hit in the back, you could, injure a kidney, you could bruise it or lacerate the kidney. And so that all would be kind of on my mind. It doesn't explain the fever. The fever is a little
Right.
bit odd with that.
Yeah, so
And,
delayed presentation after trauma.
Yeah, delayed.
You'd think about the intestinal problem because that's how you get the fever. Is it gets infected?
Well,
right?
what about like even worse stuff? Like you don't know what his sexual history is. It's the turn of the century. He's traveling all across the globe. Does he have
Hey,
syphilis
fair.
and a mycotic aneurysm?
Wow. Yes.
abdominal
Possible,
aorta?
right?
I
Possible.
don't think it's that unfair to
Yeah.
consider some of those things. I mean, didn't like
No,
160% of the
absolutely.
population have tuberculosis back then?
Great call out. Yeah.
Yeah. Mm-hmm. Yeah.
Right,
he had
it's,
like an abdominal scrofula. I don't know if they call it a
Mycotic
scrofula.
aneurysm. So you actually get an infection in the blood vessel in your stomach. Yeah. And then it can pop. Yeah. That's a great thought.
Could be a lot. You guys would be nailing it on Grand Rounds right now.
Mm-hmm.
You get put on the spot and ask for a big old differential for
Yeah.
something.
The
that's, like,
14th
obvious.
resident to come up with
Yeah,
a
but-
differential diagnosis.
But
What
then,
else could
yeah,
it be?
just be dropsy,
Let's just say, yeah, dropsy or Quincy.
Quincy.
One of the two.
Yeah.
Scorpion
So,
bite.
so- anyway, returning to Houdini. So he's in the hospital a couple of days and they decide, let's go to the operating room. And upon opening his abdomen,
Wait, did
They
they
find
tell
that
him
he
what they
had-
thought? Sorry for interrupting. Did
Oh,
they
yeah.
tell him like what they thought he had?
I did. I tried to find the hospital records to see if they were somewhere in the public sphere. I did find his death certificate, which got released like in the last 10 years, but
Mm.
I wasn't able to really find the day to day. I really wanted to.
Because if you think about who he is, right? He doesn't like people who aren't straightforward, right? He doesn't like these charlatans that are like trying to take people's money. So I'm sure he would be one of those people. Like maybe there was a delay because he was like, "Why are you taking me to the operating room?" And they're like, "Because." They couldn't explain
Could be.
why.
Yeah.
Good. I think it's a very reasonable question. I didn't come across it in the articles that I did read for this. And there's some, we'll get into some of the speculation a little bit later about like how what will transpire did transpire. But it's kind of both as straightforward as you might think, but not at the same time, which I know is not a very helpful sentence as I hear it out loud when I say it. But I think we'll kind of go through a little bit of the twists and turns here. But yeah, I don't know if they were upfront with them. Hey, we think this is what's going on. I mean, I think they probably were based on what I'm going to describe as far as what they knew about his actual diagnosis at the time. But so either way, they do eventually convince him, let's go to the operating room. He's still spiking fevers. They open him up and they find he has diffuse peritonitis, which is inflammation of the lining of your inner abdomen. And it's generally speaking, peritonitis is from infection from some bacteria that are in your intestines or gut that are no longer in your intestines and gut and are now just inflaming and infecting the lining of all of kind of the organs in the abdominal cavity. It's bad and it hurts a lot. And so it looks to the surgeon like they find this peritonitis, and it's described that they find a perforated appendicitis is what they feel is going on. And the perforated there refers to an appendix that has fallen apart, basically has become so inflamed that it broke down and then lets stuff from inside the colon outside the colon. That's bad, definitely bad. And so that's kind of their leading diagnosis. And the surgeon does a washout, basically literally what it sounds like. He's, irrigating clean fluid, probably water or saline at this time. I think they had saline. I don't know for sure. But basically washing out all the infection and peritonitis as best as he can. And when I say that too, I should say a lot of times when they open the abdomen and the appendix has fallen apart and it's a big old pus pocket. It just forms pus inside your abdomen. And it's as gnarly as it sounds. And if you've ever been in on one of these operations, it also smells amazing.
Yeah, no, it's bad.
Yeah, it is. It's very bad. And you know what's even worse? In 1926, we don't have antibiotics.
Yeah, that's why I was just looking up. So, yeah, this is right now like the really bad kid. I think one of the worst cases I ever saw was somebody had like this power washer with basically antibiotic solution that they washed the whole thing out, and then they would just like power wash it all with antibiotics, like this antibiotic goop.
Yeah. So we have antibiotic goop now. So whether you give antibiotics through the IV or you can make, I'm going to just use antibiotic goop. I mean, a shot solution that you can literally spray into the abdomen.
Is that Gwyneth Paltrow's antibiotics?
No, that goes somewhere else.
No, these actually work.
It's not in the power washer.
Difference. So Houdini goes for the washout. But then a couple of days later, he's still spiking fevers, and they decide to take him back to the operating room and basically wash him out again. Like, yeah, we don't have antibiotics, so we don't really have an alternative at this time. And so they take him back, they wash him out. Apparently he does survive that, but by Halloween, October 31st, which I think is, that's almost a week after.
It's a week, yeah.
Yeah, it's 1 week after he was admitted to the hospital in 1926. Houdini dies from sepsis and overwhelming infection. He was 52 years old. I think a lot of folks may say that, he thought he died from one of his tricks and those sort of things. But actually, the official cause of death on his death certificate is perforated appendicitis. And, that's probably technically true. But there's kind of, I don't know, an interesting little connection we'll get to here.
But wait, but the doctor that signed off on his death certificate was wearing a mask and he pulled it off and it was Houdini.
What?
Right? Or no? Is that what happened?
Did that happen?
I don't know. Did it?
No, it didn't.
Man.
I know, it would be amazing. Everybody, I did resist the urge. Like everybody says this, like the one place he couldn't escape was, I'm like, oh, come on.
Was life.
Anywho, yeah, exactly.
So,
I was going to make that.
No, it's interesting. I mean, so I found a historical document on the treatment of peritonitis, and it looks like they were still arguing about whether you should even open the abdomen up into the 1910 range. So they had sort of started to wash it out with carbolic acid and such, but they were still
Joseph Lister.
They were still arguing over it because for a long time they said, well, peritonitis, you should just do supportive care, probably to let the ones that would recover and not make it worse.
Well, it's interesting, kind of a on-topic segue. So one of the interesting things that I found about researching this was sort of a rabbit hole of the history of appendicitis, which it was more interesting than I gave it credit for, because here's the thing. I mean, most people listening to the show have heard of appendicitis. And I'll go ahead and guarantee that there's more than one listener who's had appendicitis and probably would have been a surgery like maybe the only surgery they ever had. So everybody has kind of heard of appendicitis, but it's interesting that the recognition and treatment of it was pretty new for the time. And we'll kind of go through the steps of how they started putting this together. Do you guys both have your appendixes? Anybody missing one?
I
Appendices.
do have it.
Okay.
Yeah.
I got one too. That's but there is
One of us is due.
One of us is
Right.
due. So yeah, let's talk about appendicitis a little bit. Let's talk about we got to start with the appendix itself. Medically speaking, the appendix is a noodly appendage that hangs off the first part of your large intestine. That part of the intestine is called the cecum, and this is in your right lower abdomen. And so if you kind of have a picture in your head of what a large intestine generally looks like, but in an anatomical drawing, just imagine a little wormy, pinky-sized thing dangling off the end in the right lower quadrant, and you have yourself an appendix. And it's actually a hollow tube that is closed on one end and then it opens into the large intestine.
You
And
make
so
it sound so gross.
Mhm.
does
When
I
you
mean,
hit
I
bumps
could-
in the car, it goes. Blah, 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 blah.
I mean, it probably does. So that being said, appendicitis, which the word actually just means inflammation of the appendix, the itis is the inflammation, it happens when material, which mostly means poo and stuff, plugs up that opening of the appendix, and it causes the appendix sac to close off and become inflamed with your gut bacteria. It swells up, it becomes painful, and if you don't do anything about it, the likelihood is that it will expand with infection to the point that it ruptures, or as we say medically, perforates. And it causes all that bacteria in the pus, the pus is just a mixture of white blood cells and bacteria doing war and fighting, and it smells really bad. All that goes into your abdominal cavity and starts inflaming the lining of your abdomen, that peritonitis we were mentioning, and then it's bad because then all that stuff can get into your bloodstream and make you really sick, and then you get the effects of sepsis, which are your body, your immune system fighting the infection, and they can be really bad and life-threatening. Is that a pretty good summary, you think?
Yeah. Do you go through the classic presentation somewhere in here?
We will.
Okay, all right.
Yeah. So
Because I think it's a cool, like the history mirrors what's actually happening. It's kind of
definitely.
Yeah.
And so today, it's a common diagnosis. We perform surgery quickly to remove the swollen, infected appendix before it ruptures or falls apart, and we know that people don't need them to live. But it kind of raises a question: is well, you're going to remove this part of the body. What's it do, and can we take it out? Because we know we can take it out now, but they didn't always know that. So the what does the appendix do is kind of an area of some debate, and I actually had looked it up like 6 months ago or so, and just because you see it so commonly, like you guys have an appendix speech. Do you give a speech to your appendix patients?
Mm-mm.
I
just
say
like, yeah.
something like you can live comfortably without it. It might be part of your immune system, but we don't really know exactly what it does.
You say
I think
that?
That's what I say. Yeah,
I'm just like,
sometimes.
I'll talk to the surgeon. It'll be about a 30-minute surgery, and then you'll go home tomorrow.
Maybe. Actually, yeah, no, I don't always say that.
They don't need to know. Like, now you
They
can't
don't care.
potentially digest really hearty vegetables because you don't have the ability
Actually,
to do
what
that.
I usually say is, yeah, so I'll describe what it is. I don't know, man. It depends. Depends on what kind of mood I'm in. And how
Now,
much
if you have a
time I
sore throat, yeah, the lymph tissue at the base of the
Shut
appendix
up,
isn't going to
shut
help.
So as all these varying accounts of what it does or doesn't do point to, there's maybe some different explanations. So yeah, I looked it up just because a patient asks, like, well, is it really just a useless thing? I'm like, no, I mean, I
Yes.
think I've read some stuff, but let me look back. So, on I'd say the older school of thought was that it's a vestigial organ, like an organ that used to exist, but no longer, like through, eons of evolution, just doesn't do anything anymore. So you get this like little nub hanging off the large intestine that is non-functional.
Do you know what creature has a large appendix?
I mean, I know creatures that have other appendixes I'm going to mention, but which one has a large one?
Oh, I don't know. I didn't read ahead, but koalas, because they eat eucalyptus leaves.
Oh,
So the appendix, it just helps break down. I think it houses bacteria that can help break down really fibrous material.
You might be right there. I was going to say, like, so the more kind of up to date thought is that because you do see it in other species, I think it's like, I mentioned it somewhere here, but it's, like great apes have them, and apparently koalas, if what Mike says is true, which we have to
They
assume
also
it
have
is.
chlamydia. Mhm.
That's fair.
Yeah.
And then the wombats.
There you go. It's
Wombats have
another
them too.
marsupial. Yeah.
Well, so, but you're right. The thought is that it may be a kind of a harbor for helpful bacteria for the gut, and that it may be a place where the large intestine can have a reservoir of these helpful bacteria to be released for different digestive needs and that sort of thing. And so, though you can live without them, it may actually serve a function, as we're still trying to figure out, because so many animals have them. It's like, would it be a de-evolved organ in all of them, but yet still have kind of a similar shape in those things? So I think that reasonably calls into question of that. And there's always the third camp of cynics that propose that the appendix just exists to provide college funding for the children of surgeons. And so that's as neat as all that might be. It does
Easy money.
It's like one of those things you just
You can
take it
even
out.
do it
and there you
yourself.
go. Absolutely. Well, if you're Rogozov, you can call back. Anyway, as neat as all that may be, it does stand that people can live perfectly normal lives without this colonic danger noodle waiting to go off as a bomb.
Danger noodle. I like that.
I think actually internet parlance for snake, if I'm not mistaken.
Oh, okay.
Yeah,
Anyway,
but
That's not as funny.
And I think I just checked the overall, the incidence of this is like 7% of people will have appendicitis at some point in
that's
their
a
life.
lot. That's a lot of people.
That's a lot. Yeah, it's that's a lot. So that being said, like I said, it was sort of an interesting offshoot to like learn how they figured out what appendicitis was, and we're going to talk about that now, and then we'll come back to putting together all the final details of Houdini's death. So
that's 490 million people.
Yeah, I mean, I don't
Given our
In
current
their
population.
lifetime.
in the lifetime, over a lifetime.
Yeah, but
It's not like a year.
I know. I was trying to do the math too. It only went up to 700 million. On my
I want to know what
calculator.
490 appendixes look like in a pile.
Appendices.
Oh.
Can you say appendixes? I don't know that you can.
So appendicitis has been around, like many things, forever. I mean, as long as there have been appendixes, there have been appendicitis.
And
No,
it's
we're gonna use every
appendicitis.
plural to
It's
make you angry.
appendicitis.
Appendicitis. Appendici. One article I reviewed actually recalled the example of an Egyptian mummy that was, when they opened it, they discovered a bunch of scar tissue and evidence of peritonitis right around where the appendix would have been. And so at least, that's probably been going on that long.
Did males
but-
get it too?
With that?
Did males get it too? You said it was a mummy
joke.
I get it. It's a mummy.
not a daddy.
The best part is on my screen, Mike, your camera froze with you with like a smarmy look on your face. So every time you
What's
say
smarmy?
those, yeah, every time it's just you smirking, and yeah, which is not unlike the actual live camera either.
You know, I got
Anywho.
these scars.
So, but here's the thing: it actually took a while to really coin the name of the diagnosis, appendicitis, and although throughout much of human history, there were probably many cases of people likely dying from this intra-abdominal infection. It just took a while to actually put a lot of these pieces together. So before you even identify the appendix as a cause of illness, like it had to get recognition as a distinct thing of anatomy, which is kind of fun. So you might say, much like Houdini, the appendix escaped the attention of anatomists and surgeons for hundreds of years.
What did they think it was?
I want you to go back and acknowledge that joke.
Yeah,
Because they escaped. I mean, because like escaped.
I know. I can't blame you for that one,
Mhm.
David Blaine.
Well, we'll talk about what they thought it was, Mike. So well, fast forwarding from ancient Egypt. I don't know how to come back. from all that.
Speechless.
So here's the thing: the appendix itself even escaped Galen's attention, which you might
Ooh.
remember him from episodes ago. Is that famous?
That is funny,
famous
Max. Escaped because we were talking about Houdini. That is hilarious.
Oh, that's such a good joke.
Oh my God. Okay,
Man,
go
I hate
on.
you both. You might remember that famous Greek physician that we talked about many episodes ago, and he made up a bunch of BS about medicine because, well, he couldn't really perform dissections or study the human body with scientific method at the time. So I guess we'll give him that. But that being said, he really doesn't He doesn't mention an appendix as a structure, even though he did do dissections on like great apes and stuff like that. But he did mention in his writings conditions causing right lower quadrant pain and subsequent illnesses and infections. But again, he doesn't really say what the structure is. Moving ahead a little bit to more recent ancient times, there were medical texts that would describe cases of what we now know to be the more advanced appendicitis, meaning, the perforation, the rupture where you get the abscess in the abdomen. And at the time when you couldn't really do surgery on the abdomen, they would be accounts of like abscesses from inside your abdomen going through the abdominal wall. So you just imagine like this giant boil forming in the right lower quadrant, pouring pus to the outside world, then connecting your outside world to your inside abdomen. And, not that a lot of people did, but some people would actually survive this because all that infection now poured itself out. You just have to hope that you don't get a second infection in your giant abdominal.
Every time I actually think about what time travel would be like in reality, I'm like, nah, I'm good.
Don't do it. Don't do it. You could go forward, maybe don't go back. Unless you like bring all the books that were ever created about.
Just the past sucked. Yeah. And if you brought stuff with you, you wouldn't bring enough. You'd be like, oh, maybe some penicillin, but then,
Right. But then, how do you make it? I don't know. I know what it is.
You use the penicillin back then and you create the most insane superbugs now.
Oh, yeah. Back in the...
Aaron's trying to ruin the world.
No, that wasn't my plan.
It's his plan. So... people might have survived the crazy intra-abdominal abscess through the abdominal wall, but as one surgical history article I read put it, they could also have the alternative of, quote, dying a peaceful death from sepsis, end quote, which I'm honestly, I think peaceful is doing a lot of lifting in that sentence, but I don't know about the abdominal abscess coming out. Because they covered them with
a heavy blanket so they couldn't hear breathing.
Probably. So as we move to the Renaissance period, at least the appendix started kind of getting named as a structure. So first descriptions of the appendix appear in the late 15th and early 16th centuries. And before he was swinging around katanas and eating pizza, Leonardo da Vinci drew up the appendix among his anatomy drawings in 1492.
I like turtles.
Yeah, turtles. But those drawings apparently weren't actually published until the 18th century, and Da Vinci did not actually give the appendix that he drew in there a name. Just felt like, I guess, if you're drawing a large intestine, he drew all the parts. So there you go. And moving ahead a little bit more, in 1522, a professor of surgery named Berengario da Carpi, totally got that right.
Doesn't that mean Berengario of the body?
Maybe. He was a professor of surgery, as I mentioned, in Pavia and Bologna, Italy. He gave the appendix a name. I don't know that he called it the appendix. I didn't find that, but he at least said, I'm going to call this little noodly thing
It's a dangerous noodle.
Bologna, Bologna.
He called it the danger noodle. Andreas Vesalius, who we've kind of mentioned once or twice in the previous episodes, in 1543, he illustrated the appendix in his work De Humani Corporis Fabrica, but he called it the cecum and just basically lumped it together with that section of the large intestine and didn't really kind of describe it as its own thing. So he's like, okay, it's this whole thing, including the noodly thing, is just the cecum part of the large intestine. And it seems like a small point, but we're going to talk about how people didn't actually recognize it was causing problems because they kind of lumped it in with the large intestine. So it did kind of have some effect there. And I've actually, if you guys scroll down a little bit, I included a picture from his illustration in the lower notes. And so you can see it there. It's a little guy. I'll put it on the show notes if I can. Yeah,
it's cute.
There, little noodly appendix.
It looks like, what was that thing that you used to draw in middle school with the interconnected S's?
Oh yeah, the S,
looks
yeah,
like
the line,
that.
yeah. It's like every desk through the 90s had 18 of them carved into them.
It's just weird.
It was a weird thing.
It looks like a perfect drainage thing. Yeah.
Let's just take a minute and recognize the amount of work that went into this episode.
Mm-hmm.
Holy cow! This is
Jeez
impressive.
Louise. Can we split this into two? Like.
Those are just you're just looking at like the outline notes.
God, I was like, oh God, please,
no, yeah, no,
God.
You know, we work hard to provide a quality. Well, one of us works hard to provide a quality product.
We just talk crap about him while he's giving the presentation.
I know.
Yeah, it's like
this sucks. It's too long.
My life.
Wait, so that was the appendix to the.
Well, now we're going to go through all the notes.
That was the appendix to the presentation.
Oh, that's so funny. She just cut it out.
I'm gonna
Cut
spike
it out.
cut that out.
Dave
I think that's
Coulier,
good.
he was Canadian.
What?
Now, wow, so
Okay.
far afield.
Okay, moving ahead to
Anyway,
the Age of
yeah, let's-
Enlightenment. Yep.
Yeah, you guys are talking about being long, and now look who's doing all the tangents. So, Age of Enlightenment. So now we have the appendix not only identified as a thing at that time, but physicians and surgeons actually start to question it as a thing that might do something. They haven't yet then realized that it's a source for these intra-abdominal infections they would see from time to time, but they're at least thinking about it a little bit. In 1735, a surgeon by the name of Claudius Amiand is credited with performing the first appendectomy, albeit not quite what he was intending to do for those reasons. So apparently an 11-year-old boy showed up with a painful inguinal hernia. That's a hernia down the groin, and often,
It
especially
goes
in
into the
men,
mailbag.
Yep, it will go to the men's mailbag, aka the scrotum. And so what happens is the abdominal wall is kind of weak down in the groin, and the intestines, whether it's a small intestine or large intestine, or sometimes both, can actually get pushed out through underneath the skin down to the scrotum through the tunnel that has a name,
Oh, geez.
inguinal canal. Right? Yep.
Sure. Yeah, sounds right.
So essentially, he went to operate on this, and here, this hernia involved the cecum, so that first part of the large intestine where the appendix is attached. And he noted that this noodly thing, what we would know as the appendix, looked inflamed. He took it all out, and basically, he actually cured a case of appendicitis without knowing what it was before it got worse. And we call this failing correctly in the business.
Good job. I mean,
What did he do
good
with it
job.
after? Did he just sit there and stare at it? Like, what the heck is this
I wonder
thing?
what that was.
Weird.
That looks like a
Probably
little
tossed it
mini
into the
colon.
pile.
Mm-hmm.
But you guys may have heard of Amiand's hernia, which just basically describes a hernia that contains the appendix in it. So
Yep.
he
I
got
have
that.
not heard of that. Wow.
I read it and I was
Cool.
like, okay, I think I've
Pretty
seen
cool.
that before. But if you stopped me on the street, I probably would have known the reference.
I have seen it before, but that's the only reason I remember it. I didn't.
Of course you have. He's an appendix topper. By the late 18th century, famous surgeons like John Hunter of England were describing case after case of this right lower quadrant intra-abdominal abscess, and even like abscess surrounding the appendix. But they still weren't really blaming the appendix. It was just like, oh, it's just sitting in the pool of pus. But they didn't really think it was the source of a lot of these things, if that makes sense. And so in the 19th century, we start connecting some dots. And here comes some more big time name drops for you guys. In the early 19th century, Dr. Baron Guillaume Dupétrain, a leading surgeon at the Hotel Dieu, another nice callback.
Ooh.
Hotel
That whole
Dieu in
sentence
Paris.
was just like a mess.
It
like
is.
very hard to follow.
Well, okay.
With all the
No, because
Frenchness.
there's foreign names in there. That's your
Yeah,
issue
there's
with
just
it.
so many.
That's what
yeah.
I'm saying. Like, not that you did it in a messy way. It's just like, oh, my brain.
Yep. Well, Dr. Dupétrain at the Hotel Dieu, he was so he started to associate right lower quadrant inflammation and abscess with cecal pathology. Again, just that large intestine part. So he starts to at least say, I think that part of the intestine is prone to causing these infections, but he doesn't really say it's the appendix. In a work written in 1830 by a Dr. Goldbeck, the work entitled Inflammation in the Right Iliac Fossa, which I'm sure is a scorcher of a read. I didn't get around to it, but he described basically all the signs of appendicitis, but he too also said, I think it's just a large intestine problem, has nothing to do with the wormy looking appendix. And so close, but just didn't quite connect the dots. In 1848, a surgeon named Dr. Hancock performed abdominal surgery with the then newfangled chloroform anesthetic. So he got to drain an abscess that was in the right lower quadrant. It had formed around the appendix, but he actually managed to take it out before it really got large enough to like poke through the abdominal wall. So it was like a little abscess. He takes it out and drains everything, and I believe the patient does okay. About 20 years after that, in 1867, Dr. Willard Parker writes about 4 cases of having abscess around the appendix, and he actually waits for a couple of days for the symptoms to develop, like fever and worsening pain and those sort of things, before doing surgery. But his whole goal is to try to get in there, do surgery to drain the abscess before it becomes so big it comes through your abdominal wall, but being sure that there's going to be something there when you go in. And so he actually is the first guy to kind of be like, if we treat this particular problem sooner, people will seem to do better. And he was technically right about that.
Not just technically.
Right. Well, I mean, literally right. And
Yeah.
and I think one thing, like, step back and think about, these are surgeons doing surgery without CAT scans, without knowing exactly what they're going to find. They have to go by history. They have to go by examination. And so if they're going to put somebody through an 1870s, 1880s surgery, which has tons of risks.
Yeah. Still pre-antibiotic era, right? So
Yeah. So they're trying to,
surgery was probably really tough.
Yeah, absolutely. And I'm trying to not fault him for, like, hey, I'm going to wait a few days to be sure we need to do this procedure. You know what I mean?
Well, when I was in residency, they still wanted us to do that, especially like if it's a clinical diagnosis. So if you think it's appendicitis, then you go to the operating room.
We're at the very end of the era where there was an acceptable miss rate. I told this to a patient the other day. I'm like, they're going to want a CT, but there used to be a day when the acceptable normal, so let's say how to say that.
When you say miss rate, can you explain what that means?
Yeah. So it would be like, you think it's appendicitis, so you go to surgery, but the appendix is normal. You take it out anyway. That would be a false positive rate.
Yeah.
Of about 20 to 30%. Like, you should overdo the surgery so you don't miss the appendicitis because it's so bad. Yeah. I mean, that's, we're right at the end of that. And now everybody gets a scan of some form or another. So
I was going to say, how many times have you successfully given a good story to the surgeon and they're like, yep, I'll just take him to the operating room?
Yeah,
I've not had it
one or two times with a really old surgeon.
Yeah.
Who was like, sure, take it out.
I will have, like, you know what? I think you're 100% right. Let's get the CAT scan. And I don't blame. I definitely don't blame, because you want to know what you're treating. And there's been plenty of times where I'm like, this has got to be appendicitis. And you're like, nope, it was
then it was epiploic appendicitis.
Epiploic
sure. We'll get into that one. Yep.
all the forms.
Well, think of how many CAT scans you do for abdominal pain that turn out to not be appendicitis. And that's a lot of people you'd have to watch. Or
No, absolutely. So in 1886, a Harvard pathologist named Dr. Reginald Herbert Fitz, everybody has so many names back then, he presents a paper to the American Association of Physicians called, quote, Perforating Inflammation of the Variform Appendix, end quote. And he said plainly that the cause of most of these right lower quadrant inflammatory diseases is probably perforated appendicitis. He also recommended the appendix be removed prior to becoming a big abscess, and when you first suspect the diagnosis. And this is basically still kind of the standard of care today, right? You take it out before it becomes a ruptured problem. When you know it's inflamed and you can bring it out in one piece, it's a lot easier to do with a CAT scan. You could see it inflamed and say, "Oh, let's go get that out." But before you had that, you're working with fever and abdominal pain. It's not always appendicitis, as we mentioned. So in the year after that, in 1887, Dr. Thomas Morton performs the first successful operation deliberately to treat what they are now calling appendicitis, inflammation of the appendix. He was treating a 26-year-old male patient who he ultimately took to the operating room after a week of giving him calomel, which is mercury-containing stuff, soda water, stimulants, quinine, warm compresses, and good old-fashioned medical leeches. All that failed to treat the appendicitis somehow. So he takes him in, he opens the abdomen, he finds the abscess all around the appendix, he cleans out the pus, he removes the appendix as well, he washes out the abdomen, and the patient recovers well. So it hadn't fully ruptured at this point, but it was kind of on the verge. He takes it all out, he fixes the problem. And regarding that operation, one of his contemporaries, a Dr. Chapman, wrote about the case and said that gave his thoughts on the matter of whether or not he should have removed this organ, right? And he said, quote, a true variform appendix is found only in 6 animals: man, gorilla, chimpanzee, orangutan, gibbon, and wombat. There have been no doubt, therefore, there can be no doubt, therefore, that the cecal appendix is one of the parts of the human body having no particular function of significance, being of use only in animals. Which is a weird
what did he think
logic.
they did with it?
I don't know.
What else would have an appendix then? You're like, your house plant doesn't have one, so therefore it's useless.
Like I'd be like, a bunch of these animals have the same thing. It must do something. He's like, nah, it's for the animals to have. We've moved beyond using all the organs. And he said, continuing the quote, in the human being, it ought to be removed with no bad effect whatsoever. So that I thoroughly agree with Dr. Morton in what he has to say regarding the opening of the abdomen and taking out the appendix. It seems to me that the human being is better off without the appendix than with it, for it is nothing but a trap to catch cherry stones and other foreign bodies.
I mean,
it could be that's the appendicolith.
I figure the stone or debris that gets into the appendix. So they were already casting it aside. And I should also, I just feel compelled to add that Dr. Morton, the person who performed that first surgery to specifically treat appendicitis, his son and his brother both died of appendicitis. So I guess it's fairly fitting that he was one of the first to like attack it head on. So the last name dropped prior to returning and finishing with Houdini's case is that of the surgeon, Dr. Charles McBurney. Maybe you've heard that name. Probably not in regular common parlance, but McBurney's point is a physical exam maneuver. You push on the right lower abdomen in a specific place and it hurts and you're like, ooh, might be appendicitis. But McBurney was a U.S. surgeon who in 1889 described the classic case of appendicitis that we all learn about as physicians. And here's how it should work. Here's how you're supposed to get a story for appendicitis. You have a patient come in with pain that kind of starts insidiously around the umbilicus or belly button, and then it intensifies as the appendix becomes more inflamed and like starts touching the abdominal wall. So you get this pain that migrates from the belly button area down to the right lower quadrant, becomes more intense, and usually patients in the classic story should have nausea, vomiting, don't want to eat anything, and have fever. And that's how the textbook will teach it to you. I want to say in 10 years, I saw 2 cases that were absolutely classic that. Everything else was not classic that. Is that just my experience?
Yeah, it's often not classic.
It's usually not. There's some variation.
But if it is classic, then it is.
Yeah, and if you want to help us out, any patient out there, like read the textbook, and then if you decide to have appendicitis, just give us the exact story. It'll make the job so much easier.
It's one of the most fun histories because there's all these weird oddball questions. You're like, well, if you had your favorite meal in front of you right now, would you eat it? That was one I've been taught.
And then you just giggle to yourself while you're asking, like,
oh.
did the bumps in the car ride over and make your abdomen hurt more? Yeah or no?
Well, one of the, and here's the other part is like, it's always challenging in kids to diagnose, because especially younger, if you may not have all the ability to like ask all the questions you would want to ask, you have to kind of use some other tricks. So there's always a jumping test where if you have an inflamed appendix that wants to, especially wants to rupture, most people who have had it will say like, there's no way I'm going to jump up. You have a kid jump up, give you a high five, and they're not really all that perturbed by it. It's probably usually not serious.
You give them candy and then you tickle them.
What? No, that's.
Oh,
do you run a clinic out of a van? Is
that... Free appendix check.
That's our podcast will be distancing itself from Mike's independent operation
with the recent development on our podcast.
So keeping this in mind, that classic story, although it doesn't really happen that commonly, let's go back to Houdini. So, it's 1926. He shows up to the hospital. He's got the fever. He's got the lower abdominal pain, all concerning, as we said, for appendicitis. They don't have CT scans. We've already kind of talked about that. So in the modern day, he would get IV antibiotics. He would get off to an operating room. And if his appendix was not ruptured, they'd take it out completely. If it was ruptured, this part can vary a little bit. But let's say they go in there and they find that it's ruptured. They'll try to wash it out. They usually do prolonged antibiotics. And a lot of people will still do just fine. That's the good thing. But I think the interesting question is, what's with these punches to the abdomen? And did it have anything to do with it? Right? So there appears to be a couple of different schools of thought on the matter. And one is that, schools of thought of how did it get to this point? Like, what does that have to do with any of this? So one is, look, Houdini was a consummate showman and performer. And so he might have been experiencing symptoms before he got punched and just basically minuzing them, right?
He wasn't he?
Then,
or you're saying that the ankle was the issue?
It was described as the ankle. So he's just off his leg, So, but I didn't find anything that said like he was complaining of abdominal pain before all that or anything like that. But that's one thought, that he had symptoms, he was minimizing them and waited until it was just really obvious that something was wrong to go. And I should point out there, I have to appreciate, for anybody who's listening who's had appendicitis, imagine it has ruptured and it's worst and most painful and you have to like do a magic show.
Yeah, but when it ruptures, what I've heard is that people actually temporarily feel better. Like that, you get that focal peritonitis. It gets worse and worse and worse. It ruptures. You get temporary relief, and then you get way worse than you were before.
No, I don't know where he was in that arc, but fever 104 doing a magic show and passing out seems like a bad place.
He probably had appendicitis already, and the guy ruptured his appendix by punching him. That's what I think.
Interesting and possible. So that's like one school of thought. But the other issue, and you can't know for sure, but after researching this episode, I found an interesting connection. So looking through multiple sources for medical case reports in like actual real journals and stuff, there is a pretty well described arc of trauma-associated appendicitis out there, where people are otherwise fine. They have a trauma to the lower abdomen, and then they present within a day or two with true appendicitis. And so it seems that if you are able to hit somebody hard enough in the lower abdomen to where it can compress the large intestine in the area around the appendix, it can cause perforation of the appendix or start the process of appendicitis by causing localized inflammation that progresses to regular appendicitis, and then there you go. So one systematic review I found was like reviewed like 28 cases over from like 1991 to 2009. I'm not saying it's common. I'm just saying it could feasibly happen. So various causes of trauma: falls, motor vehicle strikes, hits to the abdomen. And my absolute all-time favorite was one of the cases where they described traumatic appendicitis thanks to a well-delivered camel kick to the lower abdomen.
Ooh.
And it happened in Qatar. It's amazing.
From a camel.
So, a camel kicked a dude in the stomach, and then he presented with appendicitis. But I bring this all up to say, you know what?
Sense.
I'm not sold that the punches didn't have anything to do with it.
They might have.
I think
it's
there's
a closed structure, right? The closed
structure, if accounts are true, and he was feeling fine before he gets drilled in the abdomen.
The guy pushed his fart so hard into the appendix.
I think we solved it. I think that is probably the exact.
He got punched. That little opening of the appendix just like squished together, and then the third punch, it stuck.
One like said, you could actually develop localized bruising on the large intestine to the point where it closes off the appendix, and then you might develop all your symptoms as the bacteria are unchecked in there. And so I just thought it was kind of an interesting twist. So I think punches may have had something. Trauma-induced appendicitis is a thing I didn't know existed until today. It's not common, but I think it might be the explanation here. Can't know for sure. They were going to exhume.
He's on the list of worst med students ever.
He apparently felt really bad about it for a long time.
Yeah, you should. You murdered somebody.
And I believe they had a trial too to like determine if he was at fault. They eventually said he wasn't, but now I'm going to say let's bring it back. Maybe he was.
Let's exhume his body and check out his knuckles.
That's fair. But that, gentlemen, is the unfortunate end of Houdini, and a little bit of a history of like how we figured out appendicitis was a thing.
That's a crazy history. It went back through almost, like a lot of our episodes. Called back to
all the connections.
Stuff. Yeah,
yarn, push pins everywhere. That's how we do it. About all we have time for today. So we appreciate everyone listening, and we'd love to hear from all of you out there. If you'd like to send us a message or provide feedback, we can be reached through our website, www.poorhistorianspod.com. There you will find links to our social media sites. We do take emails at poorhistorianspod@gmail.com and do work to respond to all those posts, and are anticipating enthusiastically all the mailbag posts, so Mike can figure out all your questions off the top of his head. We'd love it if our fans would take time to leave us a 5-star review on iTunes or other platforms, and we'd also appreciate you posting about the show on social media if the occasion should arise. And if you're old-fashioned, break out an Ouija board and fire up a seance. Let us know what the spirit of Houdini says about this episode of the show. He would love that. Until next time, the Poor Historians are signing out AMA.
All right, so this is the first time. Wait, just Max question. So the INK, why do we spell it out?
Because otherwise people might go to INC.
Oh, ink, like incorporated.
Yes. Yeah.
This is ink, like
which probably takes
octopus.
you to some, site. Let's see. Please to put credit card in box. Yep, sure enough.
Yes, we will ship you arteries
You choose vein treatment, New Hampshire. You put credit card in box. We sell you. We sell you domain. Yeah, that's what it is.
This bonus box, you get veins too. You get all the vessels. I can see.
Oh God, man.
We've all been on those rounds.
Mhm.
Right? You always
funny.
you always get it wrong.
Did you guys break out into a sweat reading that?
Oh no, it was just so like we've all had that almost on a daily basis had that conversation where it's like you're telling this story. Do you think it's really funny? And they're just like, why are you talking to me? Why?
And then it changes. Every single attending wants it a different way.
Yeah.
You don't like, but this
They
is
do
the
it on
way the other
purpose.
person wanted
This
to
is
hear
the-
it. And they're like,
yep.
yeah, wrong.
This is the part
Do
of
you-
breaking you down before they can build you back up again.
Do you guys drive like medical school students in residence? Did you ever drive them crazy by having things you wanted to be presented to you your way and realize what you were doing to them?
Every once in a while, I'll notice that I'm asking them a question that I'm making them guess what I'm thinking. That I will do that.
Game.
Well, no, yeah,
Yeah.
you break the fourth wall because usually when you do that, you're like, well, I'm clearly asking you to, tell me what I'm
Mhm.
thinking.
Right. And if it's
I
something I
usually-
think they should know, I'll be like, okay, I'll try to rephrase it. But yeah, you try to let them off the hook. Be like, yeah, I'll just tell you what I'm thinking. Cause
Man, torturing residents, it's like a sport. I don't know why we do it. Anywho, yeah, I like that skit.
Builds character.
it was done to us. That's why.
Mhm. Yeah, it's the only way we know how to interact with people is to be
Gotta-
mean to them.
Pay the misery forward.
Right.
Like,
It's all about misery. Anywho, all right, welcome segment. I have a cat in my lap too. She insists on being here.
Oh, I don't like cats. Get it? Does that cat have hair?
Yeah.
Or fur? What do the cats have? Fur or hair?
fur, they have fur.
She can't
It's not called a hairy cat. Why is it called a hairless cat if they have fur?
Right?
It should be a furless cat. What the hell?
far afield. Okay, so welcome segment. Aaron's leaving. Bye, Aaron. Well, Aaron just left the show, I guess.
Where'd he go?
he
doesn't
just
like
peaced
debate
out.
either.
I think you made him mad. What do you want to say about Aaron while he's gone?
We could say anything. Does he listen to these after?
I don't know. We could find out.
Yeah. Well, I mean, we will find out. Let's say some really mean stuff about him.
Aaron.
I wasn't watching because I was looking at the thing. He just up and
He did
He
the like
bounced?
one finger up, like wait 1 second, and then he
Mm.
got up and pieced out. Like he's just gone. We're staring at his chair. Looks like he has some laundry to do. Hmm.
There's always a little laundry in that dryer.
There is. What else can we tell about his? Let's see. I mean, does he have a folding table?
He does. It looks like, well, maybe like an IKEA desk turned into a folding table. Some
Yeah,
clothes that are
that's-
like relatively nicely folded,
Yeah, not bad.
but not great.
I don't. I mean, my wife actually asked me not to fold clothing anymore
Really?
because I can't do it
Like
well.
you do such a bad job.
Yeah, it's one of those where you do such a bad job, nobody asks you to do it again. Hey,
It's
welcome
like me
back.
doing this podcast.
Sorry.
Exactly. Where'd you go?
There
You
was a
thought
guy
you
at the
quit the
door.
show.
No, there was a guy at the door. Yeah, I just
Oh,
said
you
I
should
had enough.
invite him in. He could be on the show.
Like I could do that. Yeah.
Doesn't wait? You just no. You're doing it opposite. You
doing
unmuted
it-
to yell it, and then you muted yourself. You're
Now
still
you're muted.
muted.
God damn it.
Get
Okay.
it together, man.
All right. Jeez, I'm all over the place. Only professionals on this podcast are here. Yes, experienced professionals.
God, that is an old person problem right there.